State.
Good afternoon, everyone. I'm Claire Kellett. Missouri Governor Mike Parson just about to get started with his daily briefing via Facebook. Here we go now to Jefferson City.
111 positive cases of COVID-19 in Missouri, including 152 deaths. And our heart goes out to their families and their loved ones. While we never want to see these numbers rise, the numbers were projected to be much worse in Missouri had we not taken fast and decisive action to implement social distancing. Our state agencies have been working with Missouri public health experts using Missouri-specific data to track the course of COVID-19 in our state. We are seeing very early signs in the data that lead us to be cautiously optimistic that we are beginning to slow the course of the infection and see improvements across Missouri, even in our hardest hit areas like St. Louis and Kansas City. Our hospital systems still has availability capacity, and we have expanded capacity even more in case a surge occurs. Today, I am extending the stay-at-home Missouri order through Sunday, May the 3rd, so we can prepare to reopen the economy and get Missourians back to work. Between now and May the 4th, we will continue to monitor the situation and work with Missouri hospitals, healthcare providers, public health experts, business leaders, and state departments to develop a plan. With the safety of Missourians at its core, our approach will be deliberate and data-driven. I understand that social distancing has caused significant sacrifices on the part of Missourians. But as I've said before, this is a time when we must all make sacrifices. And I am so proud of the people of Missouri. Because of you, we have improved the predictions for COVID-19 in our state. You have listened. You have taken social distancing seriously. You have looked out for each other, and you have followed the stay-home orders. Because of your diligent efforts and sacrifices, we are able to put Missourians back to work. Today, I would like to explain our initial framework, which will support a more detailed plan to safely and gradually move into a recovery phase of COVID-19. Our efforts will be informed by public health experts using Missouri-specific data. We must keep up our efforts to flatten the curve and reduce our cases of COVID-19. In good social distancing continues, we will see opportunities to reopen the state for business. Our plan will have two initial phases, which are intended to protect those most at risk of exposure to COVID-19 and return Missouri to a new normal. First, to protect our healthcare workers, first responders, and other direct care workers so that our most vulnerable citizens have access to the care they need. Second, strategically reopen businesses supported by testing data and insights from employers and employees. Our Show Me Strong recovery plan rests on four essential pillars. Number one, rapidly expanding testing capacity, including testing for those who are currently contagious and those who have been developed immunity. Number two, expand our reserves of PPE by opening public and private supply chains and continuing to utilize Missouri businesses in that effort. Number three, continue to monitor and, if necessary, expand hospital and healthcare systems capacity, including alternate care facilities. And number four, improve our ability to predict potential outbreaks using Missouri's public health data. As I said, we will be following a data-driven approach that combines a number of sources on data specific to Missouri.